Hi, I'm Emily Mowland. I'm the ADHD pathway lead in Basingstoke CAMS. I'm going to talk to you about getting order out of chaos, thinking about the fact that my child won't tidy their bedroom, how to get children and young people with ADHD to do those tasks that other neurotypical children find so easy. Something I frequently hear in ADHD clinic. I tell my child to go and tidy their room, and they just won't do it. Children and young people with ADHD frequently have really messy rooms because they struggle with executive functioning. Please also see my video on reframing ADHD. They struggle to plan, prioritise, organise, get started on tasks and finish them, as well as manage their time. So, whilst it appears to be a simple, straightforward task to most neurotypical people, tidying a bedroom is actually a monumental activity that draws on every resource when you have ADHD. They don't know where to begin, and so often it's easier just not to. It's really important to understand what the challenges are. For example, prioritising tasks, being able to understand what is most important to do. Why is putting my dirty clothes in the washing basket more important than organising my books in order of size or colour? Why do I need to take my dirty plates or cups downstairs? What's so important about that? The time it takes. Being able to actually think, well, the bed will take 5 minutes to make and putting the books back on the shelf will take 10 minutes. What you may find is that they have a deadline of 2 hours because they have a friend coming over and all they've done is organise the surface of their desk in that 2 hours. Think about distractions. Whilst putting the books back on the shelf, oh, I forgot I had this one. Then they sit down with that book and then they find something on the floor that they were looking for last week. And before you know it, they've forgotten they were even tidying. Getting started. Tidying an ADHD room is a mammoth task of epic proportions. Finding the motivation to actually do it is really overwhelming. Think about transitions. Being able to transition between the different tasks involved can be super tricky. They might just get stuck after the first one. Thinking about self-regulation and impulse control. How much of a dopamine hit do you get from cleaning and tidying your room? It's pretty boring and onerous, which leads to frustration, which leads to a half-jobber burst or emotional dysregulation at worst. So, how can we help our children and young people to develop these skills? These techniques can be used in any task and are obviously individual to your child or young person, and this is by no means an exhaustive list. Stay with your child or young person or help them to create a tick list or a chart that they can follow. For younger children, this could be a visual chart using pictures from their current favourite TV programme or film. For children who find this overwhelming, you can also use Alexa and then pop in for spot checks via Alexa just to keep them on track. For little children, make it into a game. Let's see how many clothes you can grab in 1 minute. Some children will even keep a leaderboard of their stats. Chunk the tasks into simple one-step instructions. For example, let's make the bed. Then, after, let's get all the dirty cups and plates. Scaffolding in simple steps like this makes the task less overwhelming. If the child or young person is avoidant of demands, give them 2 options. For example, I would like you to take the plates downstairs or make the bed. The choice is theirs, and therefore they are in control of what they are doing. But both options will earn them praise for getting one of the things that you wanted them to do done. Sometimes the 10-3 model works really well. So 10 minutes of doing them what you would like them to do, and then 3 minutes of what they want to do. In short, children and young people with ADHD become easily overwhelmed and sometimes triggered when faced with tasks that are really overwhelming, insurmountable. They don't know how to get started. They don't know what's expected of them. So if we give them more time and the patience and the guidance, they will be able to learn those skills to become independent in doing those specific tasks that you're asking of them to do. If you need any further information, please don't hesitate to have a look at the Hampshire CAMS website. Thanks for listening.